Hi everyone, today we are here to discuss about the medical coding and medical coding career and the medical coding opportunities, career opportunities and the new programs which are we are going to introduce in medical coding and billing. So this is an important podcast and it is an important information whoever is already doing the medical coding as their career and billing their career. So this is an important information. You need to know this. I'm Dr. Naresh. I have around 10 plus years experience in medical coding. Before that, I'm a physiotherapist. I have a clinical experience around 7 years. Later on, I moved into medical coding field after taking the training in the MEDESUN Institute. So we will discuss along with my guru, Santosh Gupta sir here. So we will discuss about all about that. Hi sir.
Hi, Dr. Naresh. How are you? Yeah.
Very fine sir.
Yes.
It's nice to meet you sir.
Yes, good.
Thanks. Sir, before going to the other topics, I just want to ask one question. I heard that 45 certificates.
45,
Whenever I
exactly.
joined in medicine
Okay.
medicine Institute, that time also you have so many certifications. Now
Yes.
it is reached to 45.
Yes.
But someone says sir that is it 45 certifications is necessary to?
Okay, see here, medical coding is a highly skilled job.
Yeah.
Okay.
I get.
Basically, I'm a medical doctor.
Hmm.
In 2004, 20 years back,
Yes. Sir.
I went to US. I got training in the US and certified as a certified coder in USA. From 2004 to 2024, 20 years I'm in the same field. Because medical coding is such a wonderful field, retirement happens to medical coding only, right?
Yes. Sir.
And coming to the certification, see here, medical coding is not a job for the money. It's a spiritual experience, according to me. You are doing the medical coding to improve the quality in the healthcare, right?
Yeah.
Physicians, payers, and patients linked to the medical coding.
Yes.
So definitely, I'll say medical coding is a noble profession, skilled job. Hence, I thought that if I want to teach the medical coding, I should have a lot of expertise,
Yeah.
right? So that's why I've done all 45 certification in medical coding and health information management. The reason behind this is, see, for example, in medical coding we have ICD-10 CM, that's called diagnosis coding.
Yes.
CPT means procedure coding.
Yes.
HCPCS is for the supplies and drugs coding.
Yeah.
Now see, when you take CPT, CPT has 6 sections: anesthesia, surgery,
Yes.
radiology, pathology, medicine, evaluation management.
Yeah.
Now when you go for surgery, we have specialty dermatology, musculoskeletal system, gastroenterology, urology, cardiology, etc. Now see here, as a medical coder, you should know how to code all specialties. It's not that you pick some, you see the medical record, underline the keywords, you match the terms with the answer.
Yeah.
No, you may get the code, but that's not the way. Because you should have a clinical knowledge, first of all, and you should know how to assign the codes properly as per the guidelines, and you should know how it's going to impact the reimbursement and the quality of the healthcare. So to get this precision and accuracy in the healthcare, to share my knowledge, to help the people to learn medical coding and have a very good career, I got training in all specialties and certified in total 45 certifications. And also even I'm certified in the Australia coding also. I have passion. I have a passion to learn more, because if I don't share my knowledge, it's of no use. I believe that knowledge, if you don't share, it's of no value. Right? So that's the reason why I've done all 45 certifications and I trained more than 25,000 people throughout the India and USA and UAE. And everyone is very happy and they got certified and they got the job also.
Everyone need to agree that you have 45 certifications. Those are the credentials. It's gives that you have a knowledge in all domains. So you are an expertise in that.
Don't say I'm expert. Still, I'm learning. I'm a student only, because medical coding nobody is expert. Everyone is a student. See, in medical field, there is something is called CME, continuing medical education.
Yeah, yes.
There is no end for that. So if I say I'm expert, I'm a fool. So I'm still a student. Still I'm learning. Every day new technology comes to the market. Right? We have to learn how to code. Right? So it's an everyday learning process.
Yeah. Even doctor says they are still practicing it.
Exactly.
They don't confirm,
Yes,
already have the
exactly.
experience.
So yes, that's what I tell to my students. After certification, don't stop. Study. Learn every day. Because I said, no, it's a noble profession, right? If you don't learn properly, if you don't practice properly, you can't perform well in the companies. Yep.
It's a noble profession, sir. I agree. But because I have a clinical experience and the coding experience, a bit is easy for me. because to understand how it goes, practices,
Yes,
procedures, generally healthcare industry, how it runs.
exactly.
So understanding the document is a bit easy for me. But coming to the science background students, nowadays I seen that medical coding is just I don't say like this, but it's just pass one exam, get one certification, just if you know terminology, and just matching the terminology and matching the options, you pass the exam. So it's just about the knowledge, how to pick
Yes,
the code.
exactly.
But when to code, how to apply the guidelines,
Exactly.
it's all about the
Yes.
it's all about the once you understand. I will say one thing, sir. Billing or coding in healthcare industry runs on the medical document.
Exactly.
So if a
Documentation
person
is the king.
yeah,
Yes.
so if a person is very good at reading the document, analysis of the
And
document,
comprehend the document. You have to
Yeah.
do proper comprehension. Yes.
and also correlation, sir. And I will say
Exactly.
this AI coding, I don't know, but correlation, it is
It's
done
very
by the
important,
human
yeah.
mind only. So that's why correlation is very important. When you know subject, everyone says that subject is not a matter. Coding, if you know the just add the codes, it's the matter. But subject matter is also very
Exactly.
important.
That's right, Naresh. See here. To assign the medical codes, you can pick the code easily from the Google or any software.
Yeah.
You can match the terms and you can assign the code. And because in the live work, there's no multiple choice. Exam, you have multiple
Yeah.
choice. Live work, there's no multiple choice, right? So definitely you should know how to read the document. First of all, you should have clinical knowledge. Somebody has to train you who has expert to clinical. See, I'm basically a medical doctor. All trainers of medicine are doctors. Maybe BDS or homeopathy, Ayurvedic or some other way, right? Because they have the clinical experience.
So
See, for
everyone in
example-
the medicine, the trainers are
Yes,
only doctors.
Medicine,
Yeah.
coding academy, everyone is a doctor because we know the importance of clinical concepts in the medical coding. As you said rightly, you can match the terms and you can assign the code. No, that's not the way. So you should not do coding for the coding sake. Coding is done for the reimbursement. Coding is done for the statistics, for prediction, for analysis, and also for the quality health care.
Yes, sir.
That's why in medicine we train only the people who are from the license background, B Pharmacy or any BZC.
Okay.
People may ask, sir, why can't BA, BCom can? Yes, BA, BCom, BTech, they can take training. But what is is for them, you learn the coding, work as a builder for 1 year, and then come to coding field because
Okay.
it requires some medical knowledge, requires some clinical concepts. That's when medicine, we provide training in the medical coding and also for the medical building along with the CPM certification.
Oh,
CPM means Certified Professional Medical Builder. So once you pass the coding certification exam, when you have CPMB, double advantage for you, right? So you are a
yeah,
coder
sir.
and a builder.
Yeah, below.
So definitely prospects are more in the market when you know coding and billing. Ultimately, any employer, they want the skill.
Building coding knowledge in a RCM cycle. If you have experience of the RCM, revenue cycle management, and related to the document coding opportunities. So if you have both knowledge, then it is very good.
Exactly. So
to manage
definitely
the-
RCM requires the knowledge of coding also.
Yeah.
It's not that you call the insurance company, you take the feedback. No, it's not like that. You call insurance company, unless the denials, you assign the codes, discuss with the physician or nurse practitioner, and appeal as per the medical guidelines, and you get the reimbursement. So definitely, every coder should know about the billing. Every builder should know about the coding compulsory. That's the reason in medicine we teach both.
Yeah.
And we are the only institute in India where we provide medical coding plus CPMB certification.
Sir, giving the knowledge, okay. But I observed one thing, sir, in my career. Because I done provider side, payer side works according to their requirements. Project guidelines are basically it's requirements. The method of review is different according to their needs, which type of information they needed actually. So providers, payers, and also third party from the CMS also different BCBS,
Yes, yes.
different type of works are done. But there is more skill in the provider side coding because
Yes.
it's a more clinical experience I have.
Yes.
So it helped me to build up my career. But I am saying I also worked as a director for a company.
Oh, excellent. Very
So
nice.
last year, sir, I seen so many.
That's
people.
what, see here, Dr. Naresh, I feel very proud that all my students, now they are the vice president of the company. The entrepreneurs now. You won't believe my students got training in 2010, 2011. The salary is more than 50 lakhs per annum. Can you imagine? Same like IT industry. Because they have the experience of more than 10 years. Medical coding is the only field where you have more money. See here, money is more in the IT field. You agree, right?
Yes, sir.
More in healthcare. So medical coding is a combination of both IT and the healthcare. So definitely it's a very good profession to have wonderful career.
So that's the reason, sir. Most of the science background students, they will choose the medical coding as
Yes.
their career option.
Yes.
So and also there is no possibility to go into IT also. So it looks like an IT job. They'll sit in the system. On the
Yes.
system
Yeah,
and
everyone
they
thinks
will-
medical coding is not programming. Medical coding
Yeah.
means what? Read the medical record, understand the medical record from the doctor perspective,
Yeah.
assign the codes as per the guidelines, and as per the billing guidelines, as per the coding guidelines,
And
accurate
it
coding.
has also responsibility. So that's why I say it's a noble profession.
I
Yeah.
will say accountability, not responsibility,
Yeah,
because
so there is
you're
a-
accountable
yeah.
for what you're doing, right?
Yes, sir.
See, it's a highly skilled job. Without skill, you can't survive. So only training, passing the exam by matching the terms, it's of no use. You may get the job easily, but what happens, you may get the very less salary.
That's
See,
the thing. Yes.
even if you get 10K salary also it's a job, 20K salary is a job, to 30K also is a job, right? So you have to get a very good salary only when you get the skill. Keep one thing in the mind, Dr. Naresh, and I'll tell to everyone, you know very well, right? Only exam will not fetch you get a job.
Yeah.
You get the job only when you pass the company exam. Any
Yes.
company, when you go for interview, they conduct one examination. If you pass the company exam, getting job is very easy, because once you have the skill, they won't leave you. Right?
Yeah,
They
that's-
give
that's
very
right.
good package. Everyone, please make a note. Medical coding and medical billing certification is must. Certification is a proof of education and dedication. It's a formal proof. Certification shows that you have the knowledge, you have done the hard work. It shows your passion towards the medical coding, medical billing field. And certified coders and billers, they get more salary compared to the non-certified coders. Hence, certification is must. During certification program, you learn how to assign the codes. You will learn the guidelines. You can interpret the intricacies of the documentation and assign the codes. However, to excel in the job, to get a rewarding career, you have to learn more and you should get the skill. For that skill development, to get a best career, you have to go for the internship program at least for 2 to 3 months. After that, you have to upgrade and upskill to the fellowship programs in the specialty training. See, for example, initially you have taken the training for the medical coding certification. Very good, it's compulsory. Take training, pass the exam. After the exam, don't go for the job immediately. Practice on 1000 medical records and internship program. We are going to offer internship program through PMBA USA LLC. After that, go for the job, clear the interviews, you get a very good salary. After 6 months of time, then go for the fellowship in any specialty coding. This way, you will have a wonderful career.
Even, sir, that's the thing I'm going to say, that last year I've seen so many people. I interviewed around 3,000 people, sir. Most of the people, whoever, because the thing is, people with certified, people non-certified, people trained, non-trainers, saying everyone is same. Because even though they are having this certification, what is their certification is nothing but they will get a credential. Credential should be it's a credential for their skill. It's not only for the knowledge. Whenever I interview them, they don't know ABCD of medical
Yeah,
coding,
it's because,
also, but they got the certificates.
Say, exam is different, work is different.
Yeah.
Right? So, see, a certificate exam is such an exam where you have multiple choice questions. You can match the terms
Yeah.
and you can clear the exam very easily.
Yeah, that's the thing. At the end, companies will see whether these people, whether not these, whenever they are taking the persons now, whoever certified or non-certified,
Yes,
whether
yes.
they are capable of doing the work,
Exactly.
our projects or not. That is the
Yes.
criteria.
For Dr. Naresh, for this reason only, because I am responsible for the industry, because
Yes, sir.
being a senior most person in the India, 40 credentials and 20 years experience,
And also students are 25K.
20,000
right, sir?
2010, and I worked in US almost for 7 years. I used to travel to US to India many times because I trained in the US a lot of doctors and coding students in the US also, even in UAE. We have seen the gap is there between the training and the employment. To fill
It's
that
like-
gap, MEDESUN, along with a company called MEDESUN,
Okay.
they partnered with a company called PMBA USA. PMBA means Professional Medical Billing Association.
Okay, it's an
Which is
registered.
yes,
I seen in the.
PMBA USA is a US company.
Yeah.
Now it's completely managed by MEDESUN only.
Okay.
And through PMBA, we're going to offer internship for every medical coder.
So I thought it's
wherever
only
you got
medical
training.
building, but it is into
No, yes,
medical.
yes. Coding also.
Okay.
Yes. So at the incubator center, so we're starting an incubator now in SR Nagar, Hyderabad.
Incubator.
Yes, incubator for the offline and online.
So
Okay.
what is incubator? So
I'll
why
explain.
we
See
need-
here, for example, you are a coder.
Okay.
You clear the exam.
Yes.
Now you have a choice to go for the job immediately
Yes.
and accept salary whatever they offer.
Hmm.
You have a choice to go for internship,
Okay.
get your more skill and negotiate the salary what you want. You understood the point, right?
Yeah. Yeah.
First thing is take the salary whatever they offer.
Hmm.
Second thing is you can negotiate the salary. How you negotiate salary? Only when you get the skill.
Yeah.
So what we're doing is after training, no matter where you got training,
Okay.
come to the incubator,
Hmm.
spend every day 4 hours.
Okay.
We provide you HIPAA de-identified medical records.
Okay.
You practice on the medical records. We have mentors here, and they guide you how to assign the codes as per the guidelines.
Mhm.
Like that, you practice more than 1,000 medical records in next 2 to 3 months.
Okay, so before entering into the career,
Before going
so
for the
it's
job.
like a kickstart for my
Exactly.
career.
Now, just imagine
Okay.
you go through 1,000 medical records with a trainer, live work experience. We do mock interviews.
Okay.
After 1,000 medical records coding, you go for interview. You won't automatically
Yes, sir.
you clear the interview, right?
So live experience.
Yeah, exactly,
So I can
yes,
say this
yes.
as a simulation.
Simulation
So
exactly.
instead of
yes.
flying a real flight,
It's like experience.
you can do the practice.
It's like experience, exactly. So
Okay,
this is the
that's
way
good, yeah.
Incubator is going to help them, and also PMBA USA offering fellowship programs.
Okay.
So fellowship means what? Fellowship means what? Group of coders, they come together.
Hmm.
Trainers will be there,
Okay.
and they train them on the specialty coding. For example, surgery,
Oh.
IPDRG, anesthesia, HCC coding, etc., etc.
So only training, also training with certification credentials.
We don't say training. It's a skill development program. Training
Okay,
is done.
yeah.
Training is over.
Because everyone thinks
Yes,
that
yes.
training means some classes, and
Yeah.
there is an exam, and there is a certification. So it's not
This
like
is
that.
This is a skill development program.
Okay.
So here, in the fellowship program, what they do, assume you enroll for the FIMC surgery.
Okay, fellowship in medical
Coding
coding.
surgery.
Okay.
Specialty is surgery, right?
Hmm.
So we provide 1,000 medical records. Live
Related
records.
to surgery.
This is in surgery speed, right?
Okay.
All specialties, right?
Okay.
Now you do the medical coding.
Mhm.
You get some doubts. Trainer will help you clear the doubts. That's why you work on 1,000 medical records. Even after 1,000 medical records, go to any company. You see a surgical coder vacancy is there. Automatically, I can guarantee you'll pass the any company exam. You can demand salary. And surgery code salary is more than 10 lakhs per annum.
Even I thought, sir, and after 3 or 4 years, regularly, more into HCC, I thought to, enter into surgery. But in a conventional way, I need to do some surgery certification with paying, so many dollars.
Exactly.
So, and that also only knowledge. And the company asked, do you have any experience in surgery
Yes.
coding? But I cannot say I have a clinical experience.
Exactly, yes.
Certification. So this is a certification for the skills.
Credential for the skill.
Oh, credentials for
we
the
are
skills. Okay.
getting this, we improving the skill, enhancing the skill, empowering with the skill, and then they go for interview. See, that's a specialty of medicine. All medicine trainers are doctors, certified coders. Being a CEO, founder of the medicine, I have experience of 20 years. Because I've seen exactly how it works in US live, right? And with the partnership with PMB US LLC, along with a company called MEDESUN, you have opportunity to take the training, clear the exam,
Okay.
get the fellowship. So remember, you get training plus internship plus fellowship.
Yeah.
And top of it, providing medical billing also.
That is lacking, sir. Every
Exactly.
person's coming
Yes.
with a certification. I have this credential, this credential.
Exactly.
Okay, credential is there. Salary can be a little bit high, but whenever they enter into the work now,
The live work they can't do. Exactly.
so here the gap is between knowledge and experience.
Yeah, one more
So
thing,
whenever
Dr.
they do the work, they will get the experience.
Exactly,
So you're
yes.
filling the gap.
Yes.
So you're filling the gap with the skills.
One more thing, Dr. Naresh. Coding training is not 2 months or 3 months. Accounting is completely 6 to 8 months. If any coder, if they say, I cleared the exam within 2 months, I won't take in my company. Medical coding is a spiritual experience. You have to learn a lot. You have to see a lot of medical records. Everyday learning program.
yes.
You feel so happy once you learn coding, apply the guidelines,
Okay.
and you see that manager says coding is very good, and you get the reimbursement from the course what you done. You'll be very happy with that, right?
Sir, I will add one point there, sir. Maybe I'm a medical coder, but I need to understand whatever a doctor documents.
Okay.
So, what is the information generally they will document? What is the core? I need to understand. I may not be a doctor, but I need to understand at least what a doctor is written in the document.
Exactly. Yes. Yes.
So for this, I think, sir, this certification programs and whatever the guidelines, you're not being a doctor, or you're not a doctor, but if you follow the guidelines, if you follow the general guidelines, and if you just follow and code it now, you will report an accurate information.
Exactly.
However, the practice goes on.
Exactly.
Okay, in the healthcare industry.
Exactly, yes.
So not being a doctor, so not as a doctor, you can still report the information accurately,
Yes.
just following the guidelines.
Exactly.
It's in an indirect. It's like
Yes.
an automated driving, I can say.
Exactly.
So but here lacking is even this training also. I heard, sir, just in a 1 month complete
Okay.
course and pass the exam. Just in 10 days, sir. 10 days, how they can just go with all this
No,
information.
see, I'll tell how it works is, you get a question in the exam,
Yeah.
you have multiple A, B, C, D, or maybe fill in the blanks, maybe it may come in the future, we don't know, right? You match the terms. See, when you match the terms, you get the answer. So
Yes.
probability is very high, you can pass the exam, but that's not required, right?
Yeah.
So definitely, so to summarize, to be a medical coder,
Yes.
6 months, 8 months training compulsory, skill is compulsory,
Yeah.
internship is compulsory,
Yes.
and fellowship is must. Place medical billing is training, internship, skill, fellowship, and mock interviews. So when you have these things, you get a wonderful job.
Yes. It's not like just entering within a certification.
No,
With a credential.
No.
So if you
because
got
it's half-boiled, right?
yes.
So
Yeah,
exam is
understood.
one part.
It's
Leave that
correct.
aside. Right? Afterwards, you had practice for 3 months.
Yeah. Even in my career also, when I'm as a director also, I have taken so many freshers with
Okay.
1 year experience, with 6 months, 2 years experience, but they are not that much, capable to do the work.
Exactly. I'll tell
Even
the reason.
I personally given the trainings to
Yes,
understand,
yes.
to summarize
Yeah.
the informations. So I think for any persons overall there in a medical coding and building program, and whoever is entering into the medical coding and building, as they are starting. So this fellowship and this skill set program is very useful.
Very, very, very much. And one more thing, the fellowship is free for them. For limited
Oh,
time,
okay.
fellowship is free. Because see, the motto of the PMBA, even PMBA completely managed by medicine in India.
Okay.
See, when I've seen people have spent a lot of money, you won't believe every medical coder.
So that's the thing, sir. I understood, for the certification only we need to pay this much.
A lot of money, exactly.
So you are
Yes,
giving
yes.
skill sets,
Yes.
some skill sets,
Yes,
free of cost.
okay. So under the certificate diplomacy,
Okay.
see in every medical coder in India, anywhere, they spend a minimum 1 to 2 lakhs per annum only for memberships, to buy the books, and to use CUs. So CUs is compulsory, of course, you have to spend money
Yeah.
for that because upgrade your knowledge. They spend a lot of money to upgrade themselves, to upskill themselves, right?
Yes.
See, now you are making the money for your family for survival. So definitely to fill that gap,
Yes.
and PMBA with medicine giving the program called fellowship. So automatically you get there's no financial dependency. You get the world class training, and
Okay.
without practicing 3 to 4 months, you won't get the fellowship. Once you have fellowship, that shows your knowledge and skill.
So here I will add one point, sir. As you said, there are different programs in FAMC, surgery, inpatient,
Anesthesia,
and
anesthesia, exactly. Yes, yes.
Okay, so it's a better opportunity to change their career into a different specialty.
Exactly. See, it's a very good question, Dr.
Okay.
Naresh. See, I'll give an example. A lot of students, what they do, they take the exam, they go for job for one specialty.
Mostly, I
They-
will say, sir, 80%, 70%, there are more opportunities in HCCs.
HCC,
Mostly
yes,
people go
yes.
into HCC.
Okay, they go for HCC, for
Yeah.
example, right? Many coders, they after certification they go for the job, and as I said, mostly they go for HCC coding.
Yeah, any other?
Yes,
No.
okay.
Mostly ICD.
Now what happens here? 1 to 2 years they'll be very happy.
Yes.
Afterwards, now they want to learn more. They want to upgrade and upskill. They want to make more money,
So
right?
here, sir, you are saying that they want to upgrade their skills.
Yes.
But I see in most of the people, they with career development means from coder to auditor, auditor to maybe if he has more skills now, knowledge now, maybe an SME, or I can able to communicate with everyone, good
Yes.
communication skills,
Yes.
maybe in a manager, team manager. So he's good with dealing with people now, maybe in a senior manager. I seen this type of careers, but whenever coming to the subjective part now, so no people want to still continue into the same way, because the lacking thing is they don't learn a new thing, new information is not learned.
To learn the new thing,
Yeah.
they have to spend a lot of money.
Yeah,
So
yeah,
that's
that
the
is
reason
also
why
there.
PMBA came with the fellowship programs. We are the only institute in throughout India where you get the fellowship programs, specialty training, all specialties without any financial burden. So I'll explain more in detail, okay? See here. Assume a medical coder went to HSC. After 2 years, now you want to upgrade and upskill. Now you can't spend the money, right? So for them, now they want to become a surgery coder. So again, he can't spend money, lakhs of rupees to learn surgery coding and go for the job, because any company after certification, they see only skill.
Yes.
Not they don't expect to have certification by revenue, right?
Yeah, yeah.
So to fill that gap, we have the fellowship programs.
Okay. Okay. If I have a company, if I'm a director now,
Yes.
so if I want a people with skills now,
Surgery coding, for example, anesthesia coding.
so okay.
Yes.
Okay. So I
Fellowship,
can get a good.
people with fellowship, FIMC. I challenge you to interview.
Oh.
Definitely they clear the exam.
So they are
company
skilled
exam.
people.
Because
Not the
we
certified
certificate is
people.
awarded only
Okay.
when you go to the live work experience.
Yes. Yes. That's
It's
correct,
not the
sir.
theory part.
It's not a theory part. Yes.
You work on the system, the live work experience, you see the medical records, you apply the surgical coding guidelines. The trainers are doctors themselves who has the clinical knowledge.
Yes.
They teach the clinical concepts, and then you become perfect in the subject and you get the skill.